Discuss of emergency. This year showed that there were a lot of questions from emergency room and the emergency medicine. One of the very important life-saving procedures is our cardiopulmonary resuscitation. So based on the recall, we wanted to know which are the true statements about adequate CPR, or also sometimes called as effective CPR. So it can be multiple answers can be correct. It can be multiple answers correct answers. We wanted the true statement about adequate or effective CPR. This is based on the recall that I've got from the students. So we wanted to know that what are the possible correct statements. So when you do the CPR, cardiopulmonary resuscitation, you are focusing upon the depth, the frequency of the compression, depth and the frequency of the chest compression. You are also going to ensure adequate time for recoil. You must also ensure adequate time for recoil, adequate time for chest recoil you are going to perform. And usually what are we going to do along with this allowing adequate time for chest recoil? If at all we are going to give breaths, we are going to give it in the ratio of 15:2, okay, or 30:2, depending from different protocols, single user, double user. But the average ventilation, the breaths that we give are usually only 8 to 10 per minute. 8 to 10 per minute. So if we look at the effectivity of the CPR, when do we say the CPR is effective? When the depth is 5 to 6 centimeter. Okay. So 2 inches, that is 5 to 6 centimeter, is a true statement. Depth of compression should be 5 to 6 centimeter, also written as 2 inches, is a true statement. You will give rate of compression, frequency 100 to 200 per minute, frequency 100 to 120 per minute, 100 to 120 per minute, and you will allow adequate time for chest recoil, So you can say that the true statements are A, C, D are correct statements, are the correct statements in this question. A, C, D are correct statements in this question. Ventilation should be 8 to 10 per minute only. Ventilation should be 8 to 10 per minute only. Right? Note this please.